I'll just finish by telling you what we don't do. We don't handle the cash. The National Health Funding Pool Administrator will be overseeing the cash distribution to local hospital networks. So if the money doesn't turn up on the 1st of July, don't ring me. I was tempted to say ring Ken Barker, but I can't anymore. The National Health Funding Pool, Mary probably is more familiar with where this is up to, she might have spoken about it earlier, is being established as we speak, and Commonwealth legislation is actually under consideration by the House of Reps next week, I think. We don't evaluate performance. Di will talk to you about the role of the National Health Performance Authority soon, but essentially performance is still evaluated by governing bodies and states and territories. So we don't say whether you're efficient or not. That's still a matter for your state and your governing bodies, and there's a role, of course, for the National Health Performance Authority. We don't determine where services go, I spoke about that, and we don't determine private hospital funding, but the private health insurance funds have been involved with us in developing our methodology and our weights. We've shared them with them, they know them, and obviously they're interested in them, and so is DVA. DVA are interested in them as well, and we've had a good working relationship with those organisations. They've been very helpful in working with us, and naturally they'll take those discussions into their own discussions with their provider organisations. But we have no role in determining private hospital funding or veterans funding for that matter. Thank you for the opportunity to speak. I'll be on the panel a bit later on, so I'm more than happy to answer questions.